having tried to put people into housing firsthand early on in my first couple of years, realized that those people were right back out on the street, or weren't able to reach self-sufficiency because, of the ecosystem I talked about earlier, kind of that fox in the hen house. It's just inhumane and cruel to put somebody indoors before addressing their co-occurring conditions. I've been inside these housing first apartments. They're squalid. They're covered in roaches and rats and soiled clothes and mattresses and unused appliances. It's like what it looks like outside is what it looks like inside. And then you close that door, and now statistically double digits are now where the overdose deaths are coming from. So it's just, and there's a school of thought of, well, again, live and let live, put them inside. Dying's a part of life, and that's how they're choosing to die. Why should we intervene? Let them just do them their way, except for that we, the taxpayers, are paying for it. And it's like, I don't believe that's the right approach. And so we argue about it. The other element is we're not giving away free drugs yet. And so what do they have to do to get their drugs? They have to sell their bodies. They have to porch pirate, smash and grab, trade their, stamp cards for cash, steal, retail theft, the whole catalytic converter scandal. All of those things support their drug habit. And that doesn't go away. So you didn't solve that problem. You didn't solve the public safety problem. So that's the other reason why you treat first. But you just don't get to a path. That's why you see that cyclical in and out of jail, in and out of rehab, in and out of mental health, because we don't break the cycle with transformative programming, which my colleague Jenny Burton does with her OUT program, which she does prison reform work out in Forks. She, again, was a 30-year addict. And she's like, I was in that cycle. I was in the house. I was in treatment. I was in jail. And until I got treatment before housing and had it in a sustainable way, I was going to be in that cycle. So it doesn't end the cycle of human suffering. It just prolongs their suffering.
So to follow up, I think you recently did an op-ed somewhere, and it was titled, A Compassionate Path Forward, Street-Level Intervention Can Save Lives.
Yeah, that I actually was inspired to write that. It was published in Center Squared, and it was after spending several hours in a room with candidates for council, for King County, for mayor. It was called The Great Debate at the Washington Athletic Club. And, we were asking these electeds and future electeds, what are we going to do about the service resistant? So we're kind of going back to that population of people who are out there, they're languishing, they're folded over, they're sleeping in a doorstep, they're getting frostbite, they're getting mugged and grimly and sadly and preyed on, whether it's, sex work for just a small amount of money to get their fix. All of those things is a grave danger to oneself. And there is a law called Ricky's Law, again, passed in 2018, that allows everyday citizens as well as law enforcement and other social workers to file for a petition through the designated crisis response team. And that's a King County team. So that's where King County can help the city, is by bringing more DCRs into the city and writing those petitions to do a involuntary commitment or a civil commitment. That is the missing link. I stand behind that. I stand behind my recovery community that all said until it was either law enforcement intervention or this kind of other element of behavioral health intervention through Ricky's Law, which we just aren't using. It's been said to be clunky. It's, there's whether it's lack of transportation. The Seattle Times did 2 different pieces on it in 2021 and 2024, or was it 2022 and 2024? Wrote about Valley cities having all this capacity that they built for secured rooms so that the Ricky's Law could be used as a mechanism to help those people suffering on the streets. The other thing I kind of wrote about there was the EMORT program in Everett, Everett's mobile opioid response team, where you have drug addicts out on the street, addicts in recovery, addicts helping addicts model, which is, by the way, worked since over 100 years ago. Anyone listening who's a part of Alcoholics Anonymous or Narcotics Anonymous, a free peer-based group where you get a sponsor and you're held accountable and you go through a 12-step program is very effective. It's worked for millions of people, and it's global wide. So you leave town and you're in Hawaii, you find your local AA group and you stay your course. So I really big shout out to something that's existed for over 100 years. But Everett's model is really the model that We Heart's doing, but they're government funded, which is you go in at the street level and you do intervention. More boots on the ground. We need hundreds of people in outreach every day in the field. We should go outside and just see hundreds of people crawling, walking, booting through the encampments, the RVs, the sidewalks, doing what I kind of call on-view outreach. Why do we have to wait for the 911 call? Why do we have to wait for that work order? You kind of ask, like, how do I pick where we go? Heck, in Seattle, you just open your eyes and walk to where there's chaos. And that's 12th and Jackson, it's 3rd and Pine, it's 2nd and Lenora, it's Ballard Leary Way, it's up on Aurora when we're talking about women who are being trafficked. So with intervention at the ground level, being proactive, right now we're spending all this money on overdose response, the Orca Center, administering Suboxone right after an overdose at the street level. Overdose response team. Everybody's really proud about, building these places for people to go willingly, which that doesn't happen, very rare. Millions of dollars going into these places when millions should be going into outreach on the ground, case management on the ground. Nobody needs to be in an office. We need to be on the ground in our mobile vans, triaging, 911, on view, state of emergency. People are suffering. They're dying. 3 a day in King County. What are we doing inside? All hands on deck. We talked about my corporate career at DHL. It's a perfect example. During peak season, everybody's shopping, right? It's Black Friday, Cyber Monday. Our warehouses were packed like sardines all of November, all of December. Guess what we had to do? Everybody had to get out of the office, out of the field, and into the warehouses and box up packages. We had to do fulfillment. We had to do pick and pack. It was peak season. Well, the drug epidemic is at peak season. And if you're a social worker, if you're a CEO, if you're being paid money that goes towards human services, why are you inside still studying, surveying, debating about what to do? We got to get on the ground. It's peak season.
Yeah, that would definitely be one of my criticisms for these nonprofits. It's like, of course, I'm making this, I have no proof of this, but it's like, to me, this is a 24/7 problem, right? This is like a lot of them that's working 8 to 5. They work 8 to 5, go home, go to weekends, go, spend time with your family. But like, I don't see how you fix a 24/7 problem by working 8 hours a day.
Well, I love New York. The program escapes me, but I think it's at least, gosh, New York's like 20 years ahead of us. So it's probably like a 20-year-old nonprofit. And that nonprofit raised money probably through government funding to put 24/7 outreach on the subways, transformed the subways, absolutely transformed them from unsafe to safe. And we have a lot to learn from New York from 20 years ago. Actually, more like 30 years ago. I always reference some of the things that New York did because it's very similar to what We Heart is, which is like service district, sort of block by block approach of kind of creating community safety, creating safety through community engagement. But it's just upside down, right? So the point is, what about on Christmas? What about on these holidays? What about the weekends? What about even the care team will tell you this is the new bright, shiny third arm of our public safety department in Seattle next to fire and police that, what most of the calls are from, midnight to 6 a.m. Well, fucking get there then.
Yeah.
Put your people off of the day shift and onto the night shift. Let everyday society that's up and give us some training, give us some Narcan, teach us de-escalation, hold a public forum about trauma-informed care. And in fact, Whatcom County did that a few years ago. Whatcom County is our neighbors north. They actually did a sort of like a all hands on deck. Everybody needs to kind of have some basic skills on how to engage with our kind of public behavioral health crisis. What if you're at a grocery store and someone's going nuts? You need to have de-escalation skills. You need to have trauma-informed skills. So like everybody is an outreach worker, are we not?
Yeah.
Why can't we all be outreach workers? Take the load off of some of our first responders and get those people working when all the hot calls are. If you know that data, why are we putting people out on the day shift? Just move them over or budget for around the clock.